anything that contributes to sportsmen looking after their heads and caring about the brain is very valuable. There's been the recent diagnosis of the post-concussive traumatic encephalopathy, which is attributed to being in the American footballers and has led to widespread changes in both the way they play, their concussion protocols, and that's spilled over into Australia, into our concussion protocols. And there's no question that if you've had a concussion, by definition a concussion is a traumatic brain injury. Now, where the line blurs between a head knock and a pathological concussion, and what I mean by that is just as you can bruise your arm, you can bruise your brain. Now, if you have a hard enough impact, you will have a bruise, and that's typically in the frontal areas and occasionally in the back areas. And that occurs because obviously most head injuries are front on, and the brain shakes because the brain is mobile inside the skull, so the brain bounces up against the skull and can bruise. Now, just as if you had a big bruise in your leg and was causing you difficulty walking, you wouldn't want to play early on that until the bruising had fully settled. And bruising from any sort of injury probably takes about 4 to 6 weeks before it fully goes. So after a significant head injury, one would expect a period of time to avoid any further injury so that you don't exacerbate the bruising until it's healed. And really, the only real way of diagnosing that is with an MRI scan, and because an MRI scan will show a tiny amount of bruising. So if we were going to be serious about assessing sportsmen with head injuries, an early MRI scan after the contact is mandatory, and that tends to occur in most situations. Where the American footballers differ in so their type of play, the American footballers used to hit with their head, and when I worked at the University of Washington, the year that the University of Washington won the college national championship, I wandered into the locker rooms of the team, and there was a sign up on the wall with a characterisation instructing them how to tackle people or how to hit people with their helmets. There was a sign showing that hit them with the crown of the helmet here, not at the back here, because if they impacted with the back of the head, it caused a flexion injury and it might cause a neck injury. They weren't particularly worried about a cranial injury. So the instruction was to hit with the crown to inflict as much possible force as one could. When you've got guys or players who are, say, 200, 250, 300 pounds, that's a huge amount of force. And you're able to impart that through a helmet because your cranium is well protected or reasonably well protected. But obviously just the simple force of doing that will impact a force to the brain. And there's no question a significant number of those athletes had significant head injuries. And where that head injury occurs is in the frontal part of the brain. And so if you examine the brains of these patients, they will show scarring of multiple impacts. Where it becomes a little bit less certain is this idea that somehow or other this traumatic scarring can cause a progressive neurological deficit later in life. And that's very unlikely. There is no real pathology that says that a traumatic injury at the age of 20 will cause a neurological deterioration when you're 50. And so the significance of the pathological changes found in the frontal lobe, because remembering the frontal lobes don't do much. So therefore just seeing scar tissue forming or changes of previous trauma should have no relevance. The issues is where do the psychological changes that come from finishing football, that come from ageing, that come from sort of different substance abuse over years, different medications, where do they mix into sort of the post-concussion syndrome? There's no question certain patients get, after reasonably significant head injuries, they will get frontal lobe disinhibition, and changes of a post-concussion syndrome, but they get them at the time of the injury. They don't develop them 20 years later. And that's the bit that will need more research to sort of flesh out exactly what contributions are what. Neurological deterioration can occur through multiple different reasons. Things such as Parkinson's disease, dementia. There's wide-ranging sort of alcohol use, drug use. Can all impact on your neurological function at a later stage. Generally, if you say finish your playing days and you're neurologically fine, 10 years later developing neurological symptoms, and deteriorating neurological function is probably not related so much to the trauma you had before.